One of the first questions many people ask after developing outer hip pain is, do I need an MRI? It's a reasonable question. Many people worry that they have torn something or they need imaging before beginning treatment. The good news is that for many people with greater trochanteric pain syndrome, hip bursitis, or gluteal tendinopathy, an MRI isn't always necessary, especially early on. In this video, I'll explain when imaging can be helpful, what MRIs commonly show, and why your symptoms are more important than the picture itself. So, do you need an MRI? Most cases don't require an MRI right away. The diagnosis of gluteal tendinopathy or greater trochanteric pain syndrome is usually made through a thorough history and physical examination. Your healthcare provider will ask questions such as, where is your pain located? What activities make it worse? Does it hurt to lie on that side? How long has it been bothering you? They'll also perform a physical examination that often includes pressing over the outside of the hip, assessing hip strength, testing single leg balance, looking at your walking pattern, and performing special tests that place load on the gluteal tendons. When these findings all point towards gluteal tendinopathy, additional imaging often isn't necessary to begin treatment. That doesn't mean imaging is never useful. Your healthcare provider may recommend imaging if your symptoms don't improve with appropriate conservative treatment, your symptoms are unusually severe, there's concern for another condition, such as a stress fracture, advanced hip arthritis, or another source of pain, if you've experienced a significant injury or fall, or a complete gluteal tendon tear is suspected. In these situations, imaging can provide additional information and help guide treatment decisions. So what can an MRI show? An MRI gives us a detailed look at the soft tissues around the hip. Depending on the individual, it may show gluteal tendinopathy, partial thickness gluteal tendon tears, trochanteric bursitis, tendon degeneration, fluid around the tendons, other structures around the hip joint. Remember, greater trochanteric pain syndrome often includes both tendon irritation and bursal irritation. Seeing both findings on an MRI is actually quite common. It's also important to remember that imaging doesn't always match your symptoms. This is one of the most important concepts to understand. Research has shown that many people have changes on MRI without having any pain at all. For example, some individuals have gluteal tendon degeneration or partial tendon tears that are discovered incidentally during imaging performed for other reasons. On the other hand, some people experience significant pain despite only mild imaging findings. This is why healthcare providers don't treat MRI pictures, they treat people. Imaging is simply one piece of the puzzle. Your symptoms, physical examination, and functional limitations are often even more important than what appears on a scan. What about musculoskeletal ultrasound? Another imaging option that can be very useful for outer hip pain is musculoskeletal ultrasound, sometimes called diagnostic ultrasound. Ultrasound allows a trained healthcare provider to actually look at the soft tissues around the outside of the hip, including the gluteal tendons and the trochanteric bursa. Depending on what we're looking for, ultrasound may help identify things such as gluteal tendinopathy, thickening or changes within the gluteal tendons, partial or complete tendon tears, fluid or inflammation involving the bursa. One advantage of ultrasound is that it can be performed in real time during the examination. The provider can move the hip, evaluate the tendons from different angles, and compare the painful side to the opposite side. It's also generally less expensive and more accessible than an MRI. So if imaging is appropriate, an MRI isn't necessarily your only option. For certain outer hip conditions, MSK ultrasound can provide very useful information about the gluteal tendons and surrounding structures. But the same principles that we just discussed with an MRI still apply. We don't just treat the image either. Someone can have abnormalities on ultrasound without those findings necessarily being the primary source of symptoms. These imaging findings need to make sense alongside your history, physical examination, and functional limitations. Finally, what about x-rays? An x-ray usually doesn't show tendons or bursa very well. However, it can still be helpful. X-rays allow your healthcare provider to evaluate the bones and look for conditions such as hip arthritis, bone abnormalities, fractures, or other causes of hip pain. Many people with greater trochanteric pain syndrome have completely normal x-rays. That's because the primary problem involves the tendons rather than the bones. Ultimately, the goal isn't just finding a diagnosis. Many people believe that getting an MRI is the key to fixing their pain. In reality, identifying the diagnosis is only the first step. The next, and often most important, is restoring the tendon's ability to tolerate load. Whether your MRI shows mild tendinopathy or a partial tendon tear, conservative treatment typically focuses on the same principles: reducing excessive compression and irritation, gradually strengthening the gluteal tendons, improving hip muscle capacity, and progressively returning to normal activities. In other words, the MRI rarely replaces rehabilitation. It simply helps provide additional information when it's needed. In the next video, we'll begin the beginner exercise program for outer hip pain, where I'll show you the first exercises I commonly prescribe to help reduce pain and begin rebuilding the strength and capacity of the gluteal tendons.